Prostate cancer is one of the most common cancers affecting men worldwide. In many cases, it develops silently without obvious symptoms in the early stages. Because of this, many men ignore subtle warning signs or delay screening. Early detection dramatically improves survival rates. Understanding PSA testing, recognizing symptoms, and knowing when to visit a urologist can save lives. What is the prostate? The prostate is a walnut-sized gland located below the bladder and in front of the rectum. It surrounds part of the urethra and produces seminal fluid that nourishes and transports sperm. What is prostate cancer? Prostate cancer occurs when prostate cells begin to grow uncontrollably. Most prostate cancers are adenocarcinomas, meaning they arise from glandular cells. According to major cancer statistics in the United States, approximately 1 in 8 men will be diagnosed during their lifetime. It is one of the leading causes of cancer-related deaths in men. However, localized prostate cancer has nearly a 100% 5-year survival rate. Why early prostate cancer is often silent. Early-stage prostate cancer usually develops in the peripheral zone of the gland, away from the urethra. Because it does not immediately block urine flow, many men experience no symptoms at all. Absence of symptoms does not mean absence of disease. Early symptoms men ignore. Although many cases are silent, some subtle symptoms may appear. Increased urinary frequency, especially at night, nocturia, weak or interrupted urine streams, difficulty starting urination, feeling of incomplete bladder emptying, mild pelvic discomfort, blood in urine, hematuria, blood in semen, hematospermia. Men often attribute these symptoms to normal aging or benign prostatic enlargement. However, persistent symptoms require evaluation. Advanced symptoms, when cancer spreads. If prostate cancer spreads beyond the gland, symptoms may include bone pain, lower back, hips, pelvis, unexplained weight loss, fatigue, leg weakness or numbness, swelling in legs. At this stage, disease may be metastatic and requires urgent treatment. What is PSA? PSA stands for prostate-specific antigen. It is a protein produced by both normal and cancerous prostate cells. PSA is measured through a blood test. It is not a cancer-specific test, but rather a prostate activity marker. Normal PSA values. Historically, PSA below 4.0 nanograms per milliliter was considered normal. However, age-specific ranges are now preferred. A men 40 to 49, typically below 2.5, men 50 to 59, typically below 3.5, men 60 to 69, typically below 4.5, men 70 plus, typically below 6.5. More important than a single number is the trend over time. What can elevate PSA? PSA may rise due to benign prostatic hyperplasia, BPH, prostatitis, infection, recent ejaculation, recent cycling, urinary retention, recent prostate manipulation. Therefore, PSA must be interpreted carefully by a specialist. PSA velocity and density. Tips of velocity refers to how quickly PSA increases over time. A rapid rise may raise suspicion for malignancy. PSA density compares PSA level to prostate size. Higher density increases cancer probability. Who should get PSA testing? Screening recommendations vary, but general guidance includes shared decision-making for men aged 55-69. Baseline testing around age 45-50. Earlier screening, age 40 to 45, for high-risk individuals. High-risk groups. Men at higher risk include African American men, men with a family history of prostate cancer. Digital rectal examination, DRE. DRE allows the physician to feel the prostate for nodules or irregularities. Although PSA is more sensitive, DRE remains an important part of evaluation. What happens if PSA is elevated? Steps may include 1. Repeat PSA test. 2. Evaluate for infection. 3. MRI of the prostate. 4. Prostate biopsy. If indicated, prostate biopsy. A biopsy collects small tissue samples from the prostate. Results provide a Gleason score, which indicates cancer aggressiveness. Gleason 6, low risk, Gleason 7, intermediate risk, at Gleason 8 to 10, high risk. Treatment options. Treatment depends on stage and risk category. Active surveillance, radical prostatectomy, surgery, Radiation therapy, hormone therapy, chemotherapy, immunotherapy, active surveillance. Low-risk cancers may be monitored rather than immediately treated. This involves regular PSA testing, MRI imaging, and occasional repeat biopsy. When visit a urologist, you should consult a urologist if PSA is elevated, persistent urinary symptoms occur, blood appears in urine or semen, you have strong family history, you are over 45 and have never been screened, you experience unexplained bone pain. Survival and prognosis. Localized prostate cancer has nearly 100% 5-year survival. Metastatic prostate cancer has significantly lower survival rates. Early detection is the key to long-term survival. Preventive lifestyle measures. While no guaranteed prevention exists, risk may be reduced by maintaining healthy weight, regular physical activity, a Mediterranean-style diet, limiting processed meats, avoiding smoking, managing metabolic health. Final message: prostate cancer often grows silently. Do not wait for severe symptoms before seeking evaluation. Screen smart. Discuss PSA with your physician. Early detection offers excellent outcomes. References: American Cancer Society, National Cancer Institute, American Urological Association Guidelines, U.S. Preventive Services Task Force Recommendations, European Association of Urology Guidelines. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you never miss an update. We've got plenty more real talk on men's health coming your way. Thanks for watching, and we'll see you in the next video.